So I think we can break into some discussions, if we will, especially given as specific of a topic as implants are. It certainly might apply or not to the people in this room. So first off, anyone use implants in their, okay, all right. So we've got two that do, cow calf side, so suckling calf implants or feedlot implants. Feedlot only.
Let the testing be the natural. For just testosterone.
Okay. All right. Very good, Carl. Very good.
We do the implants with the steer, we got to ban them.
Mm-hmm.
Give another round again before we.
Okay. And then do you market most of your calves post weaning, or do you keep some?
We back on for like 45 to 60 days.
Okay, and then market. Okay, very good. And no implants in your operation. Okay, so I'll gear it more towards a lot of the changes that occurred happened in the feedlot sector. But we can get into some of the changes or maybe more so the management structure on the cow calf side for these. So what are implants, right? So they're natural hormones or analogs of a natural hormone, synthetically made, and they been around a long time, right? 1956 was the first FDA approved. So hence kind of the title in that sense that they've been around a long time. We know a lot about this technology, and it's really something that if I had to, order the tools that we've had in our toolbox for beef production, I don't know what beats implants in terms of being able to, not only be something that's effective and a natural, something that's already occurring anyway in the animal, but also, has as a profitability standpoint for the producer and allows us to maintain and continue meeting the beef supply, right? The protein supply of the world. So we, of course, these are implanted in a very specific manner, right? Behind the ear, on the back side of the ear, and we'll go into some of the kind of the methods of that and proper sanitation, proper technique. And then usually, what these natural hormones do in the concentration that we provide them in is trigger, some physiology to improve average daily gain, somewhere between 10 to 15% in feed efficiency by 8 to 12. So that would be whether we're talking in the suckling calf or a backgrounding calf or a finishing, those numbers will move around a little bit, but that holds true no matter where we're at in that calf's production phase. And this is a little dated 2017 data, but from the USDA, but in a survey there, over 90% of cattle entering feed yards are implanted. So, I think this would be nice to update because I think we've made a lot of shifts in terms of natural programs and stuff to try to wrap our heads around where we're at there. But nonetheless, a lot of cattle, once they get to a feed yard, will end up becoming implanted. So, and there's some stigma that we'll talk about, leaving your cattle unimplanted for natural programs or organic programs and stuff like that. And we'll get into those. So like I mentioned, right, there's growth promoting implants. They increase protein deposition. So we're increasing muscle essentially over. And if you can see over here, this dotted line would be body weight of an implanted calf from, early on from 0 to 500 pounds and then so on and so forth. So they're additive in their function too. So if we use a suckling calf implant, and then we use a backgrounding implant, and then we use something in the finishing phase, those are all additive to the physiology of the animal. But essentially, to sum up what implants do, they shift the growth curve. So where the normal would be this solid line, they shift it forward, right, in terms of age. So we're just shifting that growth curve up. So those calves are reaching that maturity at an earlier age in that sense.
It is the best time to implant?
So there's some guidelines. Question was, what's the best time to implant? There are, yeah. So for suckling calf, depending on what brand you use, and I don't want to talk too much about brand specifics, but we will get into those because there's there's differences. So we'll talk about that. But the earliest you can do a suckling calf implant, depending on which one, is 30 days or 45, depending on the brand you pick. In that sense, I would say it really depends on how you're matching your nutrition to that animal. So if you might expect, no matter when you put an implant in, you say, well, not you set it and forget it type deal, but you really need to make sure that those calves are already on feed of some kind. In the suckling calf phase, that's usually at branding time, right? And that's a little different than one, making sure they're on feed and things like that. But you want to make sure your nutrition's set to go, because otherwise that implant will end up just kind of cycling through the body, and the body will absorb it in that sense. So best time to implant, there's 1,000 scenarios we can come up with, but it would be when you've got calves going on feed, you're processing anyway, hopefully in that sense. And we'll get into a little bit more of specific weather that maybe we want to avoid here in just a little bit.
That-
Yeah.
And then
Carl.
the answer to that, could it be when there's adequate nutrition to support the growth?
Yeah.
With the implant?
That's a much better way of putting what I was trying to say. Yeah, that's exactly right. That's exactly right.
Obviously, age, which, age and that type of thing, reality, the energy of the diet. Which
And-
is milk or background and finishing. gas.
Right. And you'll want to check on the labels too, because there are, like I said, in the suckling calf, but then also it might depend on when the last time they were implanted as well. So there's some restrictions on how quick you can put another implant in and that's kind of the FDA updates that I'll talk about today. Sorry. Oh, for sure. If placed properly, no, but improperly, and I have some examples of improper placements. Yeah, no, you're fine. You're fine. No, good questions. Small group, we can do that. So I have no problem with that. So please interrupt. Right. So these are the approved suckling calf implants. So Round Row, Cinevex C, Component, EC, and Compudose and Encore. So again, different products, right? This is Merck Animal Health. This is Zoetis Animal Health, Elanco, and Elanco. So
are we able to get that without a vet sign off?
yes. Yep, no script needed. And we can talk about this later on. We certainly can or can't, depend. This kind of comes down to your preferences, but these two are approved for steers and heifers. And then, depending on how you feel on that, putting them in some replacement heifers. But we'll get to that in a little bit. So residual effects. So this is some old research. Like I said, this data has been around, or this tool has been around for a long time, right? So back in the early 80s, looking at no implant or round row, and then following that, so that would have been during the suckling phase, right? I think it was, it would have been pretty early. I think 45 days old, they would have put that round row in. And then, because, right, you would have weaned at 200 and some days of age. And then, following with the backgrounding phase, right? Pretty long backgrounding phase. It was more of like a stalker overwintering situation. But anyway, in this, and what they found was the difference here. So these are average daily gains, pounds per day, right? 2.1 and 2.2. So a difference right there, you can see. And then following that same suit. So whether you implanted or not, you saw that improved performance. And when you in that same, pretty much that same effect. So again, just trying to highlight, again, it was the same implant in both situations, in the suckling calf phase and in the backgrounding phase, but they're additive in that sense. So they don't take away, when you don't implant in the calf phase, they don't take away from that improvement in the backgrounding phase, which I think is a perception we get a lot in the industry. You can set a calf up improperly by using the wrong implants at the wrong stage of life, but using them in their designated production cycle, they're additive towards that calf's growth.
So Zach, why does every sale barn auctioneer say these calves are not implanted, not implanted? They harp on that and then
I don't know why.
they ask the question.
Right. And that's a lot of the research, right? So the question is, why do sale barns? And we'll look at some sale barn data that looks at were calves truly discounted. It's not truly sale barn, I guess it's online, Superior Livestock Auctions, but we'll look at data over 7 years as to whether calves that were implanted or not actually truly received discount. Why at the sale barns do they announce that? I don't know the origins of that. I'd really like to know the origins of why do we do that.
The data doesn't support it, right?
But the data doesn't support that there should be a discount on it. Now, we're about to show, I'll show, and it's small numbers here, so I apologize. I'll talk through these. But these are implant stages. So there's 3 categories here. And again, I apologize. So this group of calves never received an implant right here, right? This one received a very, very aggressive one up front. Improper you would never do what they did here, but that was by design for the study. And then more conventional implanting system. So again, okay, days of age, right up here in this top table. So 45 days old, right? Again, nothing. They gave a Synovex 1 grass. It's way too potent for a 45-day-old calf. Way too potent. And then a Synovex, a C, sorry, that's his choice. That should be Synovex C. And then, right?
No, Choice has got the TBA in it.
Oh, it does. Okay. So a Synovex choice, but trying to think if that's approved for 45 days old. I don't think so. I need to check that. So then at weaning time, 220 days of age, right? Weaned them, no implant given there, but then they backgrounded them for 45 days, right? And so after about 45 days on feed, after backgrounding, they gave another implant, Synovex choice this time. I might have mixed those 2 up, and that should be Synovex C. And then here, again, starting at the finishing phase, 350 days of age, right? In that sense. So these are the numbers, right? These are the body weights in that sense. So we netted, in that aggressive implant, it certainly did improve physiological growth and add muscle, as did the conventional, more mild implant, right? This is 221 days. So this is at weaning. So that'd be that suckling calf phase. And then at the backgrounding phase, still added growth, right? They haven't been implanted yet. They just got implanted at that 266 days. And we've already seen now there's a little bit, these are fairly close. There's still difference if you're selling, right, these calves and paid by weight, right, of course. But they ended up, for whatever reason in the study, they got rid of these calves at that time, right, after the backgrounding phase. So there's no way to follow them up. But essentially, at 350 days, right? So non-implanted cattle versus very aggressively implanted, they gave them a finishing implant. They're at the same body weight at that point in time. And that's really because the receptors in the body were really overwhelmed in the system because they used the improper implant. So I believe that's maybe where some of the perception has lied, in that these cattle are implanted, they might not respond, right? In the sense, and they're no better than something that's never been implanted. And the data shows that's correct when you use the improper, way too aggressive of an implant at the beginning of that calf's life. But using them in stages where you basically increase concentration, right? Get more added natural hormone into the system as that calf progresses along, makes sense in our heads, I think, is the way they're designed. And so this would be off-label use anyway, regardless. That's not approved for a calf in that sense. Okay, Carl, here's your data. Calf price received by implant status, Superior Livestock Auctions, 2010 to 2018. So I combined two different publications to get here, but basically blue line, red line, these are the numbers. Again, I apologize, you all sat in the back, but they're hard to see here, but there's not much difference. Those numbers are pretty close. There's maybe some sense change differences, but and I should add these up to see really what the overall is, but but there's not much at all. You know, in some cases, it's $1 more for the implanted cattle on average in those lots. North Dakota data was used in here from the 2010 to 2013 study, right? So 17,000 lots. But no, that head, sorry, were sold that way. About 40% of cattle implanted for the North Dakota data in that sense. And I'd like to know what that number is nowadays. But again, these were by weight in terms of, I'm trying to remember, somewhere between 400 to 800 weights, I want to say. So, but that perception, right? I don't know if it's really there. It might be at the local sale barn when they make that announcement, right, to some order buyers. But on this online data, it's not there, and neither is it biologically. A reason for that to exist. For those, the producers here that are interested, this is a great online resource for you to just look up. It basically pulls a bunch of data together on what we know about implants use in the feedlot, but also on pasture. There's nothing on suckling calf data, unfortunately, but this is Merck Animal Health and Texas Tech University has a database, and I encourage you to go on there, just search that, and it's a pretty good resource just to look around at what these different implants are. Okay, I wanted to show some data that I pulled from here on backgrounding implants when we're growing a calf post-weaning in that sense. So again, row grow is something you can use when the calf is at side with the cow pre-weaning, but you can also use it post-weaning as well. And in this data set, right, we have days on feed, 140 days, so longer backgrounding phase. In weights were a little different because this is combining a bunch of different data sets. It's not all the same cattle from the same area. And here's your average daily gain. So again, the difference there being 0.2 of a pound, and those calves were gaining around 3 pounds. Again, going back to that, matching up the nutritional requirements, the nutritional needs with the physiological growth of those calves. And then you can kind of see feed intake over there on the far right in pounds per day, dry matter pounds per day. So kind of those differences from, I just averaged the implanted groups compared to the non. Again, not being brand specific here in this sense, because really there wasn't much difference between these two implants. But these are, I would say, common ones, at least they used to be in the backgrounding phase, Synovex S or a Rowgro. And it's interesting. We haven't gotten into it and we won't today, but this would be a combination implant combining trembolone acetate, TBA, you'll see it abbreviated, and estradiol, an estrogen based, and this would only be an estrogen based one. So in that, it's always amazing to me what that Rowgro can do, not being a combination implant when we know a lot of these combination testosterone and estrogen based implants usually improve growth above those estrogen only. So, and ultimately, if you add this up, an average daily gain difference, it's 30 pounds additional body weight for those implanted groups. So again, doing the, return on investment in that situation makes a lot of sense. And I'll show you an example of that. It's a big list, but these are the available, mostly anyway, of the feedlot steer implants. So these would be your estrogen onlys, like I was talking about. These would be your mild combinations, right? And as you move down this list, you can see these numbers where I've listed the concentration grows and gets bigger and bigger. These would be your backgrounding ones. Again, using these in appropriate phases, right? You're going to build to your implant program. And then for the most part, some of these are cross. Rowgro applies to both steers and heifers, but usually heifers come with their own implant, a different implant from that same company. It would be of similar concentration, but slightly different than the steers.
Back up, I just can't.
Hard to see from back there, but
I'm trying to be, is there a Synovex IS? Used to be a rough.
No, Synovex C, Synovex S. There's no IS.
There's Revlar IS, but not Synovex.
Regular IS would be similar to the Synovex S. These numbers are much different, but this is progesterone, this is TBA, and so we won't go into that today, but those would have similar effects. I would categorize those in the same area. So, and then Synovex choice. Well,
Are you gonna find this in your mineral aisle? Like when you go to look for mineral? Where will you find this stuff?
the concentrations.
No, the actual implant.
So the implant would be off the shelf at yeah, so on their own. I've got some pictures of some in a little bit, but yeah, so they would be their own product separate that you would, find wherever you're going to get, any vet clinic would have them. You can get them online as well. Again, you don't need a script for them, but you do need to read the labels and kind of build your program that way. How long do they last? I want to make sure I'm running out of time here, but how long do they last? Well, it depends, but really you consider it a proper implant, using the proper sanitation and proper application. You would expect it to last, this is kind of percent of concentration, somewhere between 50 to 120 days. It's very variable, in some regards, but you can expect it to be about 100 days long, implant. Depends on which one, but again, these are just, costs. I pulled off valleyvet.com, so you can kind of see the cost per implant that is provided, and so it's somewhere between $1.50 for suckling calf, all the way to some feedlot implants that are $3-4, up to some long acting ones that are $8-9. So a backgrounding implant, again, going back to that example where we had 30 pounds additional average daily gain. A backgrounding implant probably costs around $4 per head. You only apply it once, right, at the beginning of the feeding phase. At $2.30, so 230 a hundredweight, whether that's right or wrong now, probably outdated now, but would gross you $69 for that $4 implant, provided you fed them long enough to get 30 additional pounds gain. Minusing that $4 investment in the implant comes out to a 16 to 1 mark. That's pretty common, 15 to 1, 16 to 1. I would say sometimes, now that's in the backgrounding phase. The longer they're on feed and you have to keep, that implant only lasts 100 days. So if you're finishing cattle and they're on feed for 250 days, you're probably talking about a 2 implant strategy, one at the beginning and somewhere in the middle of the feeding phase. But then you're going to add a significant more amount of muscling to that animal. So in a background phase that lasts 100 days, you might add 20 to 30 pounds in that sense, and it's going to cost you $4 to process that animal. Maybe a little more if you have a shoot charge and stuff like that. But again, rough numbers, and I can see Carl's double checking me back there on these. But so you asked kind of, and we talked about placement. This is the implant right there underneath the ear. So it's in between the cartilage and the tissue and the skin is where you put that implant. Sorry, go forward. So proper placement, here's our ear, would be, there's kind of ridges of cartilage here and here. You want to be in between those, in the middle third of the ear this way and the middle third of the ear this way. So kind of placing that implant right in the middle.
And on the opposite side.
Right, yeah. So on the back side, right of this ear. This one was actually placed on the front, the top ridge, which you wouldn't normally put it there. So maybe I should use that picture. Well, there's less blood flow up here in this part, so that they're gonna show a little less effectiveness, but regardless, putting it right here. And using blue solution, right, chlorhexidine. A grout sponge, don't use a normal sponge. Normal sponges break apart, fall apart. And you think about this, right? You're embedding a needle in between the cartilage and the skin. And when you do that and your sponge is degrading, you're probably going to pick up a piece of sponge on that needle or in the needle. You're going to put it inside that tissue. And so you're going to cause an infection in that point. So chlorhexidine, you use this solution, which you should only use that much of it right there, just to that top ridge. So keep your empty container of this, fill it up just to that little lip. There's a lip at the bottom of it. Fill it up just to there. The rest of this, fill with water. That's the solution ratio you should be using. You should not use this stuff as pure, because what it'll do is it's gonna burn the tissue on the inside. Whatever's on that needle that goes in, it's gonna end up burning and hurting, damaging that epithelial tissue, that skin tissue. And you're gonna potentially end up with less absorption of that. Use a paint tray, right, to hold the ground sponge. And then keep a brush at your side for when that calf that was just had its head under the next one, right, and just got pooped on and it's all dirty. What you're gonna do is if you don't clean that effectively with some disinfectant, what you're gonna do is you're gonna embed some of that manure into that tissue. And again, anything would cause an infection. It's not great. I saw this. I don't know if this is coming from one of the implant companies or where it's from, but it's a handy little tool here that holds your tray. You could fill this with disinfectant for the brush, you know, and I think that would be great. It kind of has everything you need. Discard bucket and trash and everything like that. Pretty handy and hip side. So, okay, I'm about out of time. So what I want to do is go just kind of bring up. So these are all the ways we can reduce implant effectiveness. You can crush the pellets by pressing those into that ear. And that'll end up doing is basically the body absorbs them really fast, right? And so you'll be pretty disappointed with your cattle and by using an implant if you crush it during application. You said, do they fall out? You can go through the cartilage, right, and shoot it through the ear. So that way they can fall out. The body can push them out if it gets infected, but more so usually what the body will do is, again, if you didn't properly sanitize that back of that ear or sanitize that needle, what you end up with is an infection, and then it'll just get hard and the body wall that area off. And you'll find that implant there 150 days later, untouched. Or, right, if you implant before you put a ear tag in, and then somebody comes behind you and puts an ear tag in, right? You're pretty much going for the same real estate on that ear, possibly, right? Depending where you like your ear tags. Tag first, and then avoid that area on your implant, because otherwise you'll end up crushing it. And you'd be disappointed with your implant.
Or just do the other ear.
I was just gonna ask.
Or just do the other ear. But in a situation like yourself, where you're putting a calf implant in one ear, you may want to go on the other ear for the growing implant, potentially anyway. And so in that situation, yeah, you're gonna battle ear tags most likely. Okay, I'm about out of time.
Follow.
So the biggest thing I wanted to bring up was that there's a new FDA requirement that requires you to, and I had a lot more than 20 minutes worth here. This is currently the only implant Synovex Choice that's approved to be reimplanted during the feedlot phase. So read your feedlot implant labels. Synovex, go back here. Encore, Compudos, Synovex C, and Synovex S. Those are all already approved to be reimplanted within a production phase.
So do they want that? I mean, is that what that's what they want?
Yes, so. Yes, so, as I said, like implants last somewhere
Yeah.
between about 100 days. A lot of cattle are on feed for 180 days, 200 days. And in that sense, you can put 2 implants in. A lot of producers were doing that. And I say 2 implants, I mean one at the beginning of the feedlot phase and another farther down the road, not at the same time. That's never been allowed. And so in that sense, they've come out with new regulations that say the label on the implant has to say allowed for re-implant. And a lot of labels didn't say that. And so that means we can't use those back to back. Now, production phases are changing. So you all participate in this production phase. And then I'll be done, promise. So these are the production phases for a calf. Calf less than 2 months of age, calf older than 2 months of age. these would be your suckling calf implants, right? While the calf is with the cow. When you wean that calf, it either goes into production phase 3 or 4. Growing beef steer on pasture, growing beef steer in a dry lot, or potentially, I guess, could be 3, 4, or 5, growing in confinement or slaughter. So these might be your heifers, right, in a dry lot scenario where you're feeding them mostly forage-based diet. They might go out on, you know, in this case, they could go out on dormant pasture, or this particularly usually pertains to calves going out on pasture in the springtime or in the feedlot. Anyway, these are the production phases, and their implants are approved for those phases specifically. So we talked a lot about the suckling calf ones. That's been around a long time. There's been backgrounding ones that we use, but now there's a little more regulation. So at the end of the day, just make sure you're checking with either the sales rep or the implants that you're getting them from, checking with your veterinarians should know somewhat about this. Again, they're not privy, that they aren't necessarily involved in this. It doesn't take a prescription, but, or you can always call your extension agent. And they've heard this multiple times, and we can get involved with discussions on proper programs for implants, making sure you're following guidelines. But that's all I have. Sorry, I went over.
What about purebred?
Pure breeds don't matter. Yeah, in that sense, it's all about calf age in that regard. Now, breed don't matter in terms of using implants, but you wouldn't necessarily you don't want to put an implant in your breeding stock. So that's where you can technically use a suckling calf implant on replacement heifers, but that comes down to your preferences in that situation. You'd never implant bulls, and for the most part, I would say just avoid implanting any breeding animals, replacement heifers or what. Yeah.
If somebody screws up and implants the heifer, you want to be back for replacement.
Should be okay. I was waiting for that question, but I'm out of time. But here's the change in pregnancy rates. Yeah, here's the change in pregnancy rates over 15 trials. So these would be bad, right? A decrease in pregnancy rates from implanting the heifer. As a calf, you implanted her before you knew she was a replacement female, right? And then you decide after weaning, she looks pretty good, we'll keep her, but you implanted her. This is the effect of that implant way down the road on pregnancy
My
rates.
question was really is weaning time, you're gonna implant it.
I wouldn't.
But you did,
Yeah,
because they're gonna go to feedlot and go, I think maybe we should breed them.
sure.
In reality, one implant's not gonna squid.
Probably not. Probably not. And a lot of data's been done on that, right? And so a lot of data's been done on that, and you can kind of see there's probably a lot of other variables that affect what's going on here.
What advantage is it to implanting heifers? They haven't, I mean, steer, I can understand that a bull and the bull calf and the steer, but.
You increase the pelvic area of that heifer potentially. You've grown her that area, right? Her bone structure is a little bit bigger in that area. It allows you to not have to try to make that decision right then, right? You might decide down the road. And so it might come down to where you're not implanting all your heifers when you could have implanted some that are bound for the feedlot, because you're not sure which ones you want to keep or not yet. So if you implant them all, it allows you to still have that flexibility in doing that while also capturing the additional 20, 30 pounds of growth on the heifers that you're selling to a feed yard, maybe something like that. Sorry, I need to be done now. Happy to visit though.